Dr. Kavita, you'll tell us if you are live already. Hello, Udita ji. Hello, Kishore ji. Kavita madam, are we live?
So checking.
We are live on YouTube, I guess.
I think so. Just let me check, sir. It was not showing for me.
So there will be a lag of 15 seconds between what we discuss here and on YouTube. So we're just checking.
Yes, sir. It's live. Yes.
Okay. Hi. Good afternoon, everyone, and a warm welcome to all of you, our esteemed panelists, and of course, the audience who are watching us on YouTube. I'm Artishman Mahapatra from GRID Council, and I feel very privileged to have this discussion going on today, and the privilege to welcome all the guests and to initiate it. Now, we all know that the COVID-19 pandemic has hit us badly. Of course, beyond the pandemic, we are still struggling with our old diseases, both communicable and non-communicable diseases. Hypertension is an important non-communicable disease, and we with GRID Council in collaboration with Banaras Hindu University, Institute of Medical Sciences, under the principal investigator role of Sangeeta Madam, are doing a project called Reach Hypertension. We thought that we should revisit our entire approach, and with the context of NCDs, widen our approach from hypertension to NCDs, and see how the youth could be mobilized to combat, control, and prevent NCDs. Now, we all know that India is a young country. According to 2011 census, youth 15 to 24 age band people were constituting around 19%, 20%, almost a fifth of our population. But it's somewhere projected that by 2020, there should have been around 33% of India's population, 1/3. So that's a huge population, and these are formative years. And they have a role to play now, not just by inculcating good lifestyle, healthy behavior, but also by mobilizing people like their peers as well as their seniors and juniors. So there's a massive role expectation from the youth going forward, and that's a broad context of today's discussions. We have a very informed, experienced senior panel. And that panel constitutes of course, Sangeeta Kansal ma'am is there. She's the principal investigator. Ma'am, if you could switch on your video and then say a quick hello.
Hello, everyone.
Yes, so ma'am is the professor and the former head of Department of Community Medicine, IMS BHU. Then we have Dr. Zoya Ali Rizvi. Ma'am is the Deputy Commissioner of Adolescent Health from Ministry of Health and Family Welfare, Government of India. Thank you for joining us, ma'am. We have Dr. Kalpana Apte. She is the Secretary General CEO of Family Planning Association of India. Welcome, ma'am. Hello. We have Dr. Ajay Kheda. Sir is the country representative of Engender Health. Welcome, sir. We have Ms. Pooja Rao. She is Associate Director, DASRA. Yes. Hello. Hello. Then, of course, we have our colleague, Dr. Kavita Rajesh. So she coordinates all programs at GRID Council, and she is there. And we have two more colleagues who are youth representatives, Mr. Sai Daksh and then Dr. Kalika Maheshwari. Welcome both. We have Dr. Sanjay Pandey, Dr. Udita Chaturvedi, and Mr. Kishore Acharya, who shall be facilitating at the back end. Thank you so much, everyone, for joining in today. So over to Sangeeta Madam for the opening remarks.
I want to share the slide Achasman. Thank you, Achasman.
Yes, ma'am.
Can I share my screen? Yeah.
I think you can share it. No, ma'am.
It's disabled.
Just a second.
Yeah.
Can you do it now?
No, it's just still disabled. Yeah.
Yes, we're getting you.
So it's not sharing. Yeah. It's not sharing.
Yes, we're getting your shared screen, ma'am.
Yeah. Slides are visible?
Not yet.
No. Now it's visible?
Yes, ma'am.
Okay.
Can you switch on your video also? Your video has got.
Yeah, sure. Okay. Good afternoon, everyone, and welcome to today's webinar. Today, we have with us esteemed speakers, experts from the different part of the country, from the Ministry of the Health and Family Welfare, and heterogeneous group of participants, postgraduate MD students, research scholars, medical social workers, staff from the Center of Excellence, Adolescent Health, BHU. Indeed, it's a golden opportunity for all of us to share, interact, and understand the role of youth in curbing the or tackling the major health crisis, today's world's major health crisis. We all know that youths are the future of nation and builders of nation. They are the pride of the nation. They have lateral thinking, technology savvy, fresh mind, powerhouse of infinite energy. And I must say that youth with this background may reverse the trajectories of health, or rather the disastrous trajectory of health. Let's discuss how. We all know, we are aware that India is a young country. 35% of uh, 15 to 24 contribute 35%. The adolescent currently 243 million constitute 21%. It's a big number. And ignoring the potential of this huge number is a fatal mistake. While searching the literature on the role of the youth in tackling the or in controlling the NCDs, I came across few interesting words like triple dividend. Lancet Commission on Adolescent Health and Wellbeing highlighted this concept. If we focus on 10 to 24, we will get the triple benefit. First, during the adolescent itself. Second, during adult life. And third, in the next generation. And investment in the Adolescent delivers a triple dividend in this way. Few studies are published on by saying that youths are the change agents or agents of a healthful change and opportunity for the actions. They are the missing population in universal health coverage. Every age should have access to the universal health coverage. And very importantly, youth voice is insufficiently acknowledged in policies. We are aware, we all know that political will is half battle. There is a strong need to change or right word is a paradigm shift is required in the approach from the cure or treatment to the prevention. And I think Dr. Zoya is the right person to comment on that. One more interesting thing in our mind that traditionally NCD viewed as a disease of elderly, disease of urban area. But now the scenario is changing. Another aspect we are already using in RMNCH plus A is a life course approach, continuum of care. This is a real golden opportunity or age of opportunity to curb non-communicable diseases because majority of the risk factors begun during adolescence or youth. In this way, youths are the key stakeholders in controlling non-communicable diseases. If we invest $1 in adolescent health or youth, we will get tenfold benefit in socio-economic development. Regarding the burden of disease, these are some facts that now the scenario is changing because of the urbanization, industrialization, epidemiological transition. The non-communicable diseases are more in low and middle income countries, countries with the transitional economies. And there also the major risk factors are tobacco use, physical inactivity, and harmful use of alcohol and unhealthy diets. Regarding India, 1 in 4 Indians has a risk of dying from an NCD before they reach to the age of 70. A report published by Ministry of Health and Family Welfare, India Health of the Nation State, mentioned that there is an increase in the contribution of NCDs from 30% of the total disease burden. Disease burden is measured in terms of the disability adjusted life years. This is for the participants. In 1990 to 55% in 2016. And also there is an increase in the proportion of the death due to the non-communicable diseases from 37% to 61% in 2016.
Madam, could you please put it on full screen and like we have 2 minutes more to this?
Okay. I have searched some data regarding risk factors and NCD. In India, data regarding NCD among adolescent or youth is limited. So the global scenario for the NCD, this slide shows that hypertension prevalence among adolescent is 4.5%, diabetes by the age of 15 or more than 25%, cardiovascular diseases 70 among the obese youth 70%, chronic lung disease 1 in 10 young people, cancer is more in Europe among the young people under 15 years, leukemia, and the commonest one is a mental health disorder. By the age of 20, 1 in 4 young people will suffer from at least one mental health disorder. And 3/4 of all mental health diseases start before the age of 24. One more important NCD, intentional and unintentional injuries, homicide, suicide, and motor vehicle injuries account for 75% of the all adults deaths in high income countries. For a country like India and other developing countries, more data is available on the risk factors. I have chosen some recent publications to show uh, the data regarding risk factors, unhealthy diet, physical inactivity, lifestyle. This study shows the conducted by Neha Rathi et al. And among the 14 to 60-year-old adolescent, and it's showing that 30%, only 30% are consuming vegetables, 70% are consuming 3 or more servings of these snacks, and half of the respondents did not consume any serving of fruit, and 47% reported drinking 3 or more servings of the energy dense beverages. Similarly, in other studies regarding lifestyle, they are snacking during talking, during watching TV, and they are missing, most of the time, they are missing breakfast. Regarding substance abuse, the study was conducted among the college students in Varanasi. So it was 32%. And most of them initiated just because of the peer pressure. A study from Gujarat conducted among school-going students also shows the similar, almost similar data regarding lifestyle, unhealthy diet, substance abuse, non-communicable diseases. Only 11.6% participants consume food daily. Consumption of the junk food is more. Carbonated drink is more. High salt diet is more. And only 2.2% addicted to tobacco. 87% boys doing physical activity at least 30 minutes, and there's a gender difference between the um, taking unhealthy diet or doing physical inactivity and blood pressure. With these words, I just want to close my talk, and with the hope that this webinar will help you to come forward and work for tackling this invisible epidemic. And I wish a fruitful and excellent discussion go ahead. Thank you so much.
Thank you so much, madam. Oh, we get a photograph from Varanasi. Right. You need to press on the side. Yeah.
Yeah.
Thank you so much, madam. Thank you. You gave a broad overview of the situation of NCDs in our country, and of course, much lifestyle-related issues. Moving on to our youth representatives. So what we did is, as an experiment, we thought that we should have two youth representatives, one young man and one young woman, and they could speak their heart out. So we have not moderated any bit of what they're going to talk. We do not know. It's a full surprise for us as well. So it's your podium, Mr. Sai and Dr. Kalika, entirely yours. I would request Mr. Sai to go in first. 5 minutes to you, and then to Dr. Kalika. Over to you.
Good afternoon, everyone. I'm Sai, and I'm a 17-year-old student. I represent Gen Z, and it is very humbling that I am putting forth my views on this topic in front of all the leading experts from the country. My views are only based on what I have read and my life experiences as a young person. When I was told to do this talk on what young people want in the context of non-communicable diseases, I did what any young person in the world would do and sought help from Google. This is what I found. A non-communicable disease, or NCD, is a disease that is not transmissible directly from one person to another. According to the World Global Health Status Report, non-communicable diseases account for most causes of premature death and disability worldwide. So here are some statistics. Non-communicable diseases kill 41 million people each year, equivalent to 71% of all deaths globally. Each year, more than 15 million people die from an NCD between the ages of 30 and 69 years. 85% of these premature deaths occur in low and middle income countries. 77% of all NCD deaths are in low and middle income countries. Cardiovascular diseases account for most NCD deaths, or 17.9 million people annually, followed by cancers, which cause around 9.3 million deaths, then respiratory diseases, which is 4.1 million, and diabetes with 1.5 million. Children, adults, and the elderly are all vulnerable to the risk factors contributing to NCDs, whether from unhealthy diets, physical inactivity, exposure to tobacco smoke, or the harmful use of alcohol. These diseases are driven by forces that include rapid unplanned urbanization, globalization of unhealthy lifestyles, and population aging. Unhealthy diets and a lack of physical activity may show up in people as raised blood pressure, increased blood glucose, elevated body lipids, and obesity. As a young person, I feel that the entire youth or young population can play a major role in combating NCDs in the future, because we are in the stage of life when our choices, habits, and lifestyles today affect our health tomorrow. Encouraging young people to make healthier food and lifestyle choices to lower their NCD risk needs intentional and sustainable behavior change. Behavior change must begin during early childhood and should be fostered all throughout the youth's education and beyond. It has been a month since I have cut out a lot of junk food and unnecessary calories from my diet, and already feel a lot healthier. I lost 4 kilograms in that same duration, and I believe most of it was excess fat mass. Heartburns were also frequent earlier, but I haven't encountered even one this last month. But sadly, a lot of my peers still fall prey to high calorie, unhealthy, and processed foods. On top of that, most of them did not actively exercise or play a sport anyway, and the pandemic made that worse. Getting young people to change unhealthy and sedentary behaviors and mindsets can be more effectively achieved with the help of other young people. Governments and schools play a key role in ensuring that behavior change activities are done among children and adolescents. Getting young people actively involved in driving these efforts is just as critical, if not possibly even more effective. Often it is in the Often it is in the lack of solutions that make addressing NCDs difficult, but the need for more holistic and sometimes even appealing solutions aimed at sparking interest among the people who need these interventions the most. This presents an opportunity for young people to use the knowledge they have about their peers and what will get them moving and making healthier lifestyle decisions. Providing young people with the tools and guidance to think about how to get their peers to make healthier decisions is key to maximizing their involvement in combating NCDs. It has been famously said that this generation has the attention span of a goldfish, and I can confirm this. We need information in clear and concise nuggets with little to no technical terms. We need information that is scientific, appeals to our logic, and is actionable. We need content that is engaging and motivating without becoming overwhelming. We need institutions generating content which is suitable to us. We need role models that walk the talk. So I look forward to learning a lot from the experts here so I can do my bit in creating actionable content that will help my peers. Thank you for this opportunity.
Thank you so much, Sai. Despite your young age, you have touched upon many issues which appeal to us. So these are quite insightful and thought-provoking. Thank you so much. It's a well-researched speech that you made. Thanks again.
Thank you.
Moving on to Dr. Kalika.
Hello, am I audible?
Yes, you are. Please go on.
Okay. Good afternoon. I'm Kalika Maheshwari, and I'm an intern doctor at an Institute of Medical Sciences, Banaras Hindu University. I feel privileged having gotten the opportunity to be a speaker among such esteemed panelists who are all experts in their fields and have some excellent work in the field of public health. Being in which I find today's topic of discussion, the role of youths in the prevention and control of non-communicable diseases in India, very intriguing. India is a young country with a young population comprising about 35% of the entire population. The youth of this nation are spirited, open to new ideas, and if motivated towards a cause, can bring about changes at a scale which are unattainable if we stay on track with our current strategies. Education given in schools primarily focuses on the theoretical aspects of health education, while the practical aspects remain largely ignored. To encourage a behavioral change, we need to shift the focus from rote learning to practical learning. I'll give you a simple example. Teaching the 7 steps of hand washing in a textbook is more likely to be forgotten rather than if the same steps are taught via visuals or a demonstration. The behavioral characteristics of this youth population stem majorly from peer influence and approval. You teach one child the 7 steps of hand washing, and he or she is likely to teach his or her friends and family the same thing. Having studied psychology, I believe exploiting the group conforming mindset of this youth population could serve as an effective tool in spreading awareness and bringing about change. Non-communicable diseases in India are said to account for about 63% of all the deaths. This significant number needs to be reduced in order to improve the socio-economic status of our country. The major NCDs like cardiovascular disease, chronic respiratory disease, cancer, and diabetes share 4 major behavioral risk factors: an unhealthy diet, lack of physical activity, and the use of tobacco and alcohol. With almost all these risk factors prevalent among the youth population, the advent of smartphones and virtual gaming just made it worse. Adolescents now prefer to stay indoors, glued to their screens, rather than going out to play. This unhealthy diet, along with the processed foods high in calories that they consume, has led to the problem of childhood and adolescent obesity, which is related to the high incidence of non-communicable diseases later in adulthood. Consumption of tobacco and alcohol in the young population is pretty prevalent. Having been in medical school for 5 years now, it is a paradox to see young doctors addicted to alcohol and tobacco despite being well aware of the dire consequences. Simple warning labels on the outer packing are not enough if we want our youth to stop indulging in substance abuse. Awareness campaigns and counseling sessions directed directly towards the youth are likely to be more effective than simple public health warnings. While working on my research project, I interacted with adolescents from both rural and urban areas. Something I noticed while interviewing them was that they were more comfortable talking to me and sharing the problems with me, as opposed to my senior colleagues who were also interviewing them. I realized that there is a need for youth representatives who can volunteer to carry out awareness drives on small scales, motivating the youth on a more personal level. Since combating NCDs largely relies on behavioral practices, the youth need to be influenced and driven to adopt healthier practices in their day-to-day life so that they can motivate others surrounding them to do the same. This will give rise to a domino effect, which will have significant impact on the overall picture of non-communicable diseases in the country. On this concluding note, I thank you all for being a patient audience, and special thanks to Professor Sangeeta Kansal and Dr. Archisman for this wonderful opportunity to be in this webinar. Thank you.
Thank you, Dr. Kalika. You talked about the conforming behavior of youth, so much role for peer-to-peer education and mobilization. Again, vital points. And of course, what I could take home from both of you is that you want action. So you want people who would walk the talk and being driven. Like if people are driven, they may inspire you and you may take it forward. So thank you so much for being on the panel today. Continuing, yes, thank you. So continuing our deliberations, I would move on next to Dr. Zoya Ali Rizvi, ma'am. So ma'am is the Deputy Commissioner, Adolescent Health, Ministry of Health and Family Welfare. And we shall be requesting her to talk about mobilizing the youth and adolescents, the RKSK experience, the Rashtriya Kishore Swasthya Karyakram experience. Over to you, ma'am.
Yeah, thank you, Archisman. It was such a pleasure to listen to these young boys and girls. I think the kind of passion which they have, the information they have access to, it has made, I think, my talk much easier. So let me just begin by saying that the experience of implementing RKSK has been really an intense enlightening, as well as it has made us as persons, me, my team, all of us have become more mature, because we are planning for implementing programs for this young dynamic age group. However, I would just like to say that with the entry of COVID, COVID has been the biggest teacher of all. It has made us actually take a step back and reassess even our priorities for adolescent health. It has made us realize what is more important among the whole gamut of important interventions which we plan for the youth. And it is also, I think, been an eye-opener for us to realize that whatever partners we have at the national level, and in fact, the implementing partners at the field, they are really very crucial for accessing this young and dynamic age group, because these are the partners who have innovated and who have managed to actually keep the adolescents still in focus. While whatever they're implementing in states, the adolescent, the school children, the youth in colleges remain to be in focus. So for that, I'm really thankful to all my partners who are, whether at Government of India level or at the state, the partners who are there. Continuing, I would try and not, I would not try and repeat the data which was presented, but just to give a brief input about what the National Family Health Survey data really shows, which already Dr. Sangeeta has referred to, and I think Kalika also has referred to a bit, and I think even Sai also referred, yeah. But just to say that the NHS4 data actually showed that hypertension testing is done in the age group of 10 to 19, and it shows that about almost 3 to 6% of 10 to 24, 29-year-old actually suffer from hypertension, which is a huge age group and huge numbers. Another risk factor which was also mentioned is the obesity and overweight, which is seen in about 4.2% of adolescent and about 14% of the less than 29-year-old youth. So this is another risk factor. Third, we also know about the diabetes. We know that diabetes too was supposed to be an adult onset broadly disease, but now more and more younger age group, adolescent and youth are getting affected. And main factors which were again very beautifully brought out by these young champions is of course the unhealthy eating habits, the lack of physical activities, the access to high sugar, high fat, high salt content foods. So all that is there, besides of course the family history of diabetes and hypertension, which is anywhere there. Another risk factor which was also mentioned is alcohol and tobacco consumption. All of us know that India has the unique identity of having a huge consumption of smokeless tobacco. And this also adds to the huge burden of tobacco-related illnesses. And what I just want to mention, you may have access to the Global Youth Tobacco Survey, which was concluded last year, 2019, and the data was shared with us recently only. And this data covered more than 97,000 children across all the states. And these children were in class 8 to 10, aged at approximately 13 to 15. So this showed that about 8.5% of these students, boys and girls, were using tobacco in any form, chewing, whether it was smokeless or smoking. That's a huge number, 9% approximately. And out of these 9%, 8% were actually current tobacco users. And the sad thing to see is that whenever the discussion was regarding use of tobacco, the usual place of smoking was at home. So these children felt comfortable smoking at home, and the median age for initiation was around 11 years. So we have to really catch them young. And what I think both Kalika and Sai brought out is that you have to start telling them about NCDs right from early primary school. So we don't have to wait for them to reach class 10 and 12 to tell them about the harmful effects of tobacco and alcohol. You have to start early because initiation age is very early. Alcohol, we know, which was mentioned, of course, approximately 9% of adolescent boys partake alcohol, about 1% of girls. So these are national level data. So all this background has been with us for quite some time. So with this background, the Rashtriya Kishore Swasthya Karyakram was brought into being, because all these risk factors was something which we had to address in school going, out of school, whatever, boys and girls who are out there in our nation. So, and the strength of this program primarily is not any clinical intervention per se, but it is the health promotive attitude which we are promoting. That they are being provided right information, right training, right referral and screening through this program. And this is addressing the NCDs through primarily behavioral change. Because we know unless you inform this young age group what is right, how they can change themselves so that they make the change themselves, these changes cannot really be brought upon by force. So these, I would just like to briefly tell you that a lot of changes were planned. So we at policy levels have I think, learned from RKSK per se, is that there is not one intervention which works. There's not one thing which you can do. We have learned that no two adolescent and youth is same. Each of them has their own special characteristics. We have also learned that you have to use a multi-pronged strategy. There's not one thing which will work. We have also learned that we have to reach these adolescents at their own spaces where they are comfortable, whether it is their homes, whether it is their schools, their colleges, their place of work. That is what we have learned. We have also learned that we have to take them on board. And it was beautiful to hear these two young people speak, because if they speak, they are on board and telling us what they want how they have actually experienced this lockdown and this increase in NCD, it really helps us, because it helps us in planning, it helps us understanding what they want in their own voice. And we also have to, I think, hear them irrespective of whether they are in secondary school, whether they're in colleges, which gender they belong to, what is their educational status, whether they're actually studying medicine or engineering, or they're still in school, whether they're rural, urban. So all these are learnings with which we are growing. With this background, we have to look at making policies and legislations in which we will try to protect this age group, to keep them safe from having access to risk factors, which will lead to increased NCD in years to come. So with this background, we have had interventions, whether it is facility-based, whether it is school-based, or whether it is community-based. So facility-based, just briefly to tell you that we have these, what you call adolescent-friendly health clinics, and we have about 8,100 odd across the country, in which there are trained medical officers and counselors who talk about how to maintain healthy lifestyle, how to maintain themselves safe. And this, we believe, is a very important area where these boys and girls can access, and we want to train our own service providers so that they routinely ask. It should not be that a person goes to ask about tobacco, alcohol. There should be a routine part of discussion when they access services. They should ask about tobacco, alcohol. They should ask about safe sexual behaviors. They should ask about diet and counseling and physical activities which these children are having access to or not. So counseling this age group, in this something which we are really working on right now. We are having refresher trainings for our medical officers and counselors so that they are trained themselves how to empathetic, how to have empathy for this age group, how to talk to them and how to address them, and how to actually support them through this changing times. Second is the community-based approach, which I mentioned, in which we have something what is called the peer educators. Now we have more than 2.5 lakh peer educators across country. And these are boys and girls who are making small groups and talking about health issues, which includes NCD. So if these peer educators are given information on what is a balanced diet, what are the nutritional deficiencies that you can have, how you can prevent deficiencies, how you can treat deficiencies. So that is a big thing which we are working on. Another big platform in community is what you call the Adolescent Health and Wellness Days. This is a huge platform which has taken up, I think, very strongly by all the states. And last year, in fact, we celebrated more than 110,000 adolescent health days were celebrated, and lot of them. And one of the most important issues which was brought out was non-communicable illnesses. So that is one major theme on which these adolescent health days are celebrated within the communities. And these adolescent health days are one thing which really binds the families, the communities, the care providers, and the adolescents also. So this is one thing which we are looking at strengthening also, again, to access even those boys and girls who don't go to schools, and greater involvement of parents in day-to-day information sharing. Lastly, what we have also have is something, what we have learned in our adolescent health. We thought that the boys and girls who are going to school, so they have to be covered using the platform of teachers. So once you train the teachers, we are hopeful that these teachers will transact joyful interactive sessions with the children in school and promote regular physical activity, will give them right information about health, how to keep themselves safe, how to have the right food, healthy lifestyle, what is a healthy diet. So these children who are actually, in fact, just to let you know that these trained teachers are actually called health and wellness ambassadors, and they are being trained across country. We have trained more than 1 lakh health and wellness ambassadors since last year, even though COVID pandemic was there. But we had such good ownership from the Ministry of Education and Departments of Education in the state. So we have trained these, and we have covered more than 22 states now across India. And this is one good momentum which has brought on parents on one side, children and teachers. So this is a whole community change which we're looking at, because each child will now actually work as some kind of a health and wellness messenger, and the change in community will take place. So that is our, I think, aim in which we want to do. And lastly, I would also like to say what mentioned by both the young people is that these people are really connected to the media, and any kind of new information technology which is out there, they know how to use it and how to use it constructively as well as destructively. So I think we as policymakers, as parents, as guides, as friends, as uncle, aunts, whatever you want to say, there is need for us to harness this media use, this internet, this information technologies in a positive way, so that this age group is actually working positively, learning positive things from it, so that they have a far healthier and happier future than we ever, I think, can hope for. So here's wishing them all the very best, and that's all from my side.
Thank you so much, ma'am. It's very heartening to see that you're trying to catch up with the youth. Now, youth are really fast, and you have actually thought about multiple modalities of reaching them. Point very valid, rightly taken, that if risk factors are being taken up that early in life, why wait till 30 or later life to intervene? So thank you so much, ma'am. There are two quick questions. We can discuss them during the Q&A session, but I've posted on the chat window. Moving on, next, we have Dr. Kalpana Apte. Ma'am is the Secretary General CEO of I'm Planning Association of India. And ma'am, I'd request you to talk about hypertension control for improved sexual reproductive health outcomes. Over to you.
Thank you, Dr. Archisman, and fellow panelists, experts, young people, and audience who are watching us now through Facebook Live. Before we discuss how we can talk about better health outcomes, sexual and reproductive health outcomes, and linking it to the hypertension control, let's take a little while to discuss what actually is the impact of hypertension on sexual and reproductive health. As we know, sexual and reproductive health is a huge, broad basket of thematic clinical areas and issues. Let us take major areas where hypertension can play an important negative role. And first and foremost, we all know that India has been struggling for many years with maternal mortality, and hypertension during pregnancy is a well-known indicator for a high-risk pregnancy and very negative pregnancy outcomes. The good news is that we are steadily making progress, and through using multiple strategies, which are public health and capacity building of providers and early detection, now the maternal mortality and also, of course, better control of hypertension during pregnancy has been possible. But let's take a moment here and let's discuss for people who are not very familiar with this topic, just to refresh their memories or just to tell them. Gestational hypertension is normally prevalent after 20 weeks of pregnancy. Even earlier, sometimes it can manifest itself. And it is known it's about 8 to 10% of all pregnancies women may suffer from this kind of a problem, which is known as preeclampsia. Hypertension during pregnancy, I would like to discuss first because it is one of the most important challenge that we have all been facing. We have all faced. People who are around this table would agree with me that it has been one of the topmost challenge for India to reduce our maternal mortality, and hypertension has been one of the important cause of high-risk pregnancies. So having hypertension during pregnancy and not treating it, not bringing it in control, can lead to multiple of problems. Basically, it works in two ways. It will not allow the placenta to develop normally, and the nutrient and oxygen supply to the developing fetus will be affected. So it has two kind of impacts. One will be on women's health and also on the developing fetus, developing fetus or the pregnancy health also of that. And it can result in a preterm birth. If it is not checked, it is completely treatable. So it's important that even before pregnancy is planned and it's conceived, even from before that, health is a very important part, that the woman is not getting into pregnancy when she is already borderline hypertensive or hypertensive. We will talk about getting pregnant or conceiving in a little while, but clinically it's important that it is caught early and screening. And so thankfully today, India's program, pregnancy management program, maternal mortality has reduced significantly. But if unchecked, if people are not knowing, and unfortunately what we see is the urban, well-educated, well-to-do people are mostly not very well aware of this particular problem. And already we have heard from this afternoon onwards that people have sedentary lifestyles. Their work will not allow them to take morning walks, or they will have high work pressures, or maybe study pressures. They will not have healthy lifestyles, and then they will end up with early onset of gestational hypertension. And it can affect heart, kidneys, and stroke can happen, preterm birth can happen, placenta can be what we call as placental abruptio. It can all happen, and good news is that if caught in time, it can be completely manageable, and it is definitely something that one must do screening for, and regular antenatal checkups are the way to go. So that's about pregnancy and related causes, and it's the most important thing that for a very good reproductive health outcome, we need to catch up pregnancy hypertension as soon as possible. The second one I would come to talk about a little bit on infertility. Now, in India, the incidence of infertility is increasing significantly. When we were studying a few decades ago, and Dr. Pandey will agree with me, and then Dr. Zoya, they will all agree with Dr. Hera, they will agree with me that when we were studying, and a few decades ago, classically, the incidence of infertility was about 10%. Among married couples, and 1 or 2 years of cohabitation. And if there was no pregnancy happening, we would say that, okay, it is infertility as per the WHO definition. But now we see increasing incidence of infertility. And one of the causative factor could be also undetected hypertension. We will say how are these things linked? And these things are linked because of the direct linkage of hypertension with the sexual health issues, particularly amongst men. If the male partner is hypertensive and undetected hypertension for some time, then that hypertension can lead to multiple negative outcomes. There could be directly and very significantly identifiable or diagnosable issue of erectile dysfunction. Then there could be some things which may not be known without a proper semen examination, and these could be decrease in semen count, sperm count, decrease in semen volume. The mobility of sperms is a very important aspect of proper conception. The sperms will have to move in the reproductive canal, and if the motility is a problem, then the pregnancy will not take place. So these are some of the direct impact of hypertension among young men, and their ability to have children, and infertility, male infertility can develop as a side effect of uncontrolled diabetes, uncontrolled hypertension among men. Similarly, among women also, it can lead to less lubrication, difficulty in having sex, and these sort of, even there have been some very fringe studies which say that the menstrual cycle and the development of ovum might be affected. So we know that undetected hypertension can lead to these kind of clinical issues, which can result in not being able to conceive. If conception takes place, then the pregnancy may be high risk, and the childbirth or the neonate, the newly born child will have issues, healthy issues, health-related issues. And then let me come to the last point that I want to make on the direct link of hypertension with sexual and reproductive health, and that is actually around mental health. We have heard about it just now, and there's a lot spoken. There is a lot of data out there. Untreated hypertension can lead to anxiety and depression. Anxiety and depression can lead to, and we know that in amongst the work that we do at the grassroots, we know that anxiety as well as depression are negative feelings, and people articulate these negative feelings in multiple of ways, one being gender-based violence. We know that it can create a lot of conflict within the family life, between the parents and children, or between couples, or between relationships. So mental health issues also can then trigger off the secondary causes can be say sexual violence and infections and high risk behavior and so on, which is not directly linked but is a causative factor. So these are the issues which can come up in the sexual and reproductive health clinical aspects. And what do we do then? What do we do? Already Dr. Zoya has given us a lot of public health programmatic strategies, and I will just take one or two out of them and say that one of the most important things that we must do is to see that hypertension awareness, that it is an early onset, that it is linked to unhealthy lifestyles, that it is that our young people today are not able to have so much of physical exercises, or they have unhealthy lifestyle, having junk food. This has to become a common health education for all young people, whether they are in school or whether they are in out of school, they are dropouts. It has to become an integral part of that. Without this knowledge, nothing can really be done much. And we have to see that the education tells them that what happens if early detection is not done. I'm not going to talk about heart issues or other issues because they are well known. I'm just limiting myself to the most important part of a human being, and that is the sexual and reproductive rights. If the sexual and reproductive health is not maintained, then there are many negative outcomes. So this needs to be known to young people. And then thankfully, technology has made it possible for us to have easy screening of people at the grassroots. Do it yourself kind of now. Now it's so easy to get, because of COVID, one silver lining is everybody almost knows about pulse oximeter, and everyone is able to see their oxygen levels and their pulse rate. It's important that we also now popularize the blood pressure measure, which is very easily available. It is a little expensive, but then let it be a health-seeking behavior that everybody goes to their family doctors or A&M or the PHC doctor to get their blood pressure measured. And as a baseline screening for all other things, we need to see that everyone gets their blood pressure measured as a routine thing. So these are some of the things important, not only education of young people, but 360 degree of education and awareness of people, family physicians and teachers and young people and their parents. And so it needs to become percolating down to the whole community. Then and then only this kind of behavior will change. Healthy behaviors will take place, and we will have fewer and fewer incidents of young people suffering from hypertension and its negative outcome on the sexual and reproductive health. I will stop here, and if there are any questions, I'll be happy to take them. Thank you.
Thank you so much, ma'am. Thank you. These are topics which we usually do not cover in our medical books, and we do not talk also as much in our medical classrooms. So thank you for highlighting these issues. Even if youth and adolescents face their unique challenges when they get into this kind of a life later on, they would face more and more of these challenges unless these are mitigated or addressed in a systematic way. Thank you so much for highlighting these issues, ma'am. If there are any questions, we'll take them up in the Q&A session. Thank you, ma'am. We'll now go to Dr. Kheda. Dr. Ajay Kheda is the country representative of Engender Health. Sir has immense experience of leading child health programs and, of course, HIV/AIDS programs as well from the Ministry of Health and Family Welfare. I would request Sir to talk on the evolving role of youth in behavior change management programs, learnings from the pandemic. Over to you, sir.
Very good afternoon to all of you. And first of all, greetings to all of you on behalf of Engender Health. And I also like to thank Dr. Archis, Dr. Sangeeta Kansal for organizing this important webinar on role of youth in prevention and control of NCD in India. And I'm so happy that you have given me an opportunity to talk about the evolving role of youth in behavior change and learning from the pandemic. You know, at the outset, I think everybody has mentioned that India is a young country with a large chunk of, young population. And this particular, such a large number is actually a untapped resource. Because, till today we have been, the using this whole so-called the youth population as the receiver of the services. We at Engender Health, believe in this philosophy of meaningful engagement of youth, where we consider youth as not only as the receiver of services, but also as the great resource in the community. And we will also agree that if you talk about the youth population as a resource, and if we start, engaging them appropriately, their engagement could have a intergenerational effect. I think Dr. Sangeeta Kansal clearly mentioned that if we engage them suitably, if we engage them meaningfully, it will not only help in changing their risk behavior, their practices, it will also help improving the behavior and the practices of the family members and the community around them. And this is also going to impact the next generation as well when they become parents. So I think it is very well known that intergenerational effects, which can really be exploited, and they could be a great resource in the community. Now, as you know, I have been asked to share some of these experiences. At Engender Health, we did 2 small experiments in terms of trying to understand that whether these young people could be a real resource in the community. The one experiment which we did was in the state of Bihar, where we could find that the neonatal mortality in the girl children was 5 points higher than the male newborn. So what we did was we identified the adolescent girl champions in the community, which were working in the community as peer educators, and we imparted them education or awareness for imparting simple messages for newborn care, which are very simple. Simple like, promoting breastfeeding, keeping the newborn warm, and keeping your hands clean. Very simple messages. And these adolescent girl champions were asked to make visit to the family where the girl child is born. Because as you know that in India, in some of those geographical areas, there is a neglect of a girl child happens. And with the result, the neonatal mortality in the girl child is noticed to be higher. So we use the power and the influence of the adolescent girls champions in making visit to the family. And the kind of the response we noticed was so encouraging. And we could find the passion among adolescent girls in taking this agenda of, gender differential in the community. And, we find very positive response. So that was, one experiment which we are still undergoing in the state of Bihar to address this gender differential in the neonatal mortality. And then the second experience where we try to use youth as a resource to impact the intergenerational thing is in the context of, the COVID pandemic. As you know that COVID pandemic has affected each and everyone in the community. But if you look at it from a economic point of view, the impact on young people, the youth population, has been much more because their education has been impacted. Many people have lost their jobs, and you must have, I think, read from the literature, newspaper items that there has been a lot of, psychological stress among youth population. And keeping that background in mind, Government of India also gave a lot of emphasis in improving the mental health situation of the young people in the country. Dedicated helplines have been created. Now, this is the kind of the experiment, which we have been asked to do with the help of support of WHO under the guidance of Dr. Zoya, Ministry of Health and Family Welfare, where we try to engage youth in spreading COVID appropriate behaviors and the practices. We did this experiment in 11 states of the country, where we identified youth champions, 5 to 6 youth champions, and then we also identified, their youth network. And in this particular experiment, we developed COVID-related messages, based on the youth perception survey. We did a very quick youth perception survey to understand the gaps in the knowledge of the youth and what youth want in terms of, implication of the COVID. So we collected that feedback from them by conducting a youth perception survey. And we also understood that what are those common, the mechanisms, common sources of information they prefer to use, and what are those media channels they prefer. And it was, quite eye opener that most of those youth, they preferred, internet as one of the important source of information. And even within social media, we could find that the youth are using, Insta or Twitter as an important source of, disseminating messages, rather than, things like, Facebook. The Facebook, kind of a reach has reduced, but reach to Insta and Twitter has really dramatically increased. Based on that perception survey, we developed specific messages, and the messages were all based on the perception survey. And the survey clearly indicated that there is a dearth of knowledge regarding vaccines. They have so many questions to ask regarding vaccines. They also had a lot of questions to ask regarding post-COVID effects, which was also quite new. They wanted to understand. And many of these adolescents which were interviewed, around 25 to 30%, were also infected by COVID. So we use the power of technology and we use this power of youth to spread the COVID-related messages. Now, the process is on across 11 states, and the kind of the technology platform they are using, the way they are disseminating messages, we are collecting numbers on a weekly basis. And as on today, we could find that these 55 to 60 youth champions and their network of around 600 people, they have already reached, more than 6 lakh youth with the right kind of messages using the power of technology. So these two experiments, clearly indicate that there is a real potential to use the energy and the passion of the youth in terms of behavior change management. These are the two experiments which were done. One was in terms of addressing those child mortality differentials, and second is, in terms of spreading the COVID-related message. I think the results have been very encouraging. We'll be publishing those results very soon. But these are, some of those experiences, and I think that this experience can also be appropriately put into practices while talking about non-communicable disease. Because non-communicable disease is all around risk factors. It's all around practices and the behaviors which start at the young age, which ultimately lead to so much of, large chunk of prevalence of non-communicable disease. And if we start addressing all these risk factors with the youth population, not as a receiver of services, but as a resource in the community, as a provider of the services, the impact is going to be really meaningful, and it's going to be a really high impact intervention. So I think with these few words, I stop here with the kind of experience we have, but there is a lot of opportunity for engaging youth for any of those, public health issues. It could be COVID or it could be non-communicable disease. So with these few words, I stop here, and I again like to convey my best wishes to this consultation. And thank you very much.
Thank you so much, sir. Thank you. It is always a pleasure listening to you. You bring in a lot of experience and wisdom. And now this time you have also highlighted findings coming primarily from the community, right? Getting the pulse of the youth, especially in the aftermath of COVID-19 pandemic. The findings are also a bit disruptive. As you said, youth are leveraging technology, but counterintuitively, it's not on Facebook, but on Instagram. So technology adoption and of course, the way they react, the energy and the passion they bring in terms of searching for information, maybe vaccines, maybe aftermath, the post-COVID complications, etc. So a lot of information sharing that must be done with the youth. Thank you so much, sir. We have the next speaker, Ms. Pooja Rao. She is the Associate Director, DASRA. DASRA does exceptional work with the youth. And from the discussions we have had thus far, we are very much convinced that youth has a massive role to play. But how does youth come forward and exercise agency? How do they ensure that they are heard or they are the change agents? So we are requesting Ms. Pooja Rao to speak on training next gen young people as advocates and policymakers for exercising agency. Over to you, Ms. Rao.
Thank you, Dr. Archusman. It's been a very interesting and engaging conversation so far. And what is clear is that non-communicable diseases are one of the biggest public health challenges of the 21st century. Dr. Sangeeta shared some very pertinent info and data about how this is disproportionately impacting young people and how the COVID-19 pandemic has really exacerbated this. For the next few minutes, I'm going to speak about, like Dr. Archusman said, how young people's participation and leadership is central and critical for us to look at preventing and controlling non-communicable diseases, but also how young people's role is very important, even in other aspects impacting their lives. Like we've seen from the data that's been presented today, the youth population is a catalytic and dynamic demographic group for India's development agenda. We at the 10 to 19 DASRA Collaborative for the last 4 years have been working on enabling meaningful youth participation and leadership across different actors, spearheading initiatives to spark and sustain a public narrative around youth participation and decision-making, and looking at how youth engagement can significantly enhance the well-being of young people and communities. When we talk about young people, it's important for us to note here that youth are not a single homogeneous group, but in fact, they have diverse perspectives, opinions, ages, identities, and backgrounds that all need to be included when we speak about this demographic. It's important for us to consider the intersectionalities, vulnerabilities, and also the diversity within this demographic. When we talk about young people, the other thing we also need to consider is how can we switch the narrative about young people's role by actually looking at youth participation and leadership, both as a process as well as an outcome. What I mean by this is if we look at health services as an example, having young people play a big role helps in improving both supply and demand. And Dr. Kera really spoke to this in the last section. In a recent conversation I had with a young person, she made 2 points about young people's role that has really stayed with me. One is that young people understand their needs and challenges the best, and that decisions about young people should be made with young people. Both Sai and Dr. Kalika, the youth representatives who spoke earlier, also highlighted these 2 points. So as practitioners, as civil society organizations, policy makers, private sector players, I think it's very important that we keep this in mind while we're engaging with young people. Let's first look at what are some of the key underlying challenges when we think about the role of young people. First of all, young people may not have always been given the resources, skills, or agency to be able to participate effectively. Second, systems have not necessarily been created where there are channels for this to happen in a formal way. This may be happening in some systems, some programs very effectively, whereas in some places it is still ad hoc or tokenistic. And the third is that materials, platforms, content for young people are not really customized for young people. Earlier, one of our speakers did speak about how we need to really move from theory to practice. So how can some of these content safe spaces be created where young people can actually engage as well as participate? Now, to be able to address these challenges, all of us here play an integral role. We need to reimagine our role as NGOs, civil society, policymakers, private sector, philanthropists, and young people themselves in terms of what role can we play? How can different stakeholders act and support the system and young people to grow? Dr. Rizvi earlier spoke about how we need a multi-pronged and multi-stakeholder approach to be able to prevent and control NCD. And no one stakeholder or one intervention alone can enable this change. Different players in the sector and in the ecosystem need to come together to be able to train young people and provide them with the right resources for them to become advocates and youth champions. Let's look at how we can actually reimagine our roles. The first and foremost stakeholder in all of this are young people themselves. We need to be able to work to equip them with the right resources, right platforms, and build coalitions so that young people are trained and equipped and channels of participation and leadership are formalized. Second, we need to think about how we can make the narrative of non-communicable diseases more accessible for young people. Dr. Kalika actually mentioned a very important point here. She used the example of hand washing on how we can actually move from theory to practice so that content can become more accessible and practical. Another important stakeholder in this ecosystem are funders and philanthropists. As funders and philanthropists, they need to look at having a more participatory grant-making approach where young people are involved and young people's needs recommendations are taken into considerations. And we're looking at underfunded areas such as building young people's capacity, behavior change, etc., to make big bets on. NGOs, civil society, practitioners, the medical community are all of us who are most proximate to young people and communities and need to more consciously include young people in program design and rollout to ensure that young people are taken along, are also part of the process in decision making. And finally, coming to policymakers and private sector players. The key aspect here is to really open up channels of participation, both to hear from them, young people that is, on what they need, and also get recommendations from them and include young people as truly collaborators and partners. RKSK is one such excellent program where the principles of adolescent participation and leadership are included. And Dr. Rizvi spoke about the peer educator model, adolescent-friendly health clubs, adolescent health day, etc., where really the ethos is that young people are at the forefront, working as peer educators, supporting with content creation, supporting with creating awareness as well as dissemination. While we reimagine each of our roles and responsibilities, we also need to relook at traditional solutions and channels to reach young people. This needs to be reinvented. Technology, like Dr. Kera spoke about, digital platforms, innovative ways of reaching different groups of young people. Young people who are in school, out of school, married, non-married, etc., are many of the groups that we need to look at. Dr. Kalpana earlier spoke about the need to start creating awareness of NCD from a very young age and actually adopting a 360-degree training methodology to ensure that it's not just about young people, but our teachers, parents, gatekeepers, community members also included in this narrative. I'd now like to highlight some examples and innovative ways that we have seen in the sector that we can kind of learn from and take forward. First, when it comes to the narrative of NCDs, we really need to look at how can young people lead this narrative? How can they create the information? How can they create content in different formats that reach a larger audience and in a language that is accessible and engaging? And Sai spoke about this when he was talking about, content made by a peer is more accessible and more likely for a young person to open and see. The 10 to 19 community of practice recently ran an initiative in Jharkhand called Mobikar, where we trained young people to become content creators so that they produce and create content on issues that are most important to them. And we saw them in the last few months, they've created content on menstrual hygiene, COVID appropriate behavior, talking about health services. How do you continue learning while schools are closed, etc. It clearly has demonstrated that when you equip young people with the right resource and the right training, they will be able to take this narrative forward. Second is partnerships with government and young people. And one of the best examples of this is really RKSK, right? Like Dr. Rizvi said, how can we look how can the government and young people partner to be able to do this in a more deeper and a larger way? The third is we need to be able to collect grounds up data to understand young people's needs, their gaps and recommendations. Some examples of how this is, some great examples of this have been social audits that have been happening to understand service delivery mechanisms, or even the youth perception survey that Dr. Kera spoke about, to really understand what are young people needs and what are they saying are their requirements as well. And finally, for us to be able to bridge civil society and practitioner recommendations with young people's input, to truly listen to what is it that young people need and what are they sharing their recommendations as. Finally, I would like to conclude by saying that each of us here need to think how our role is, how our role pans out when we think about young people's voice, including young people's voice, mainstreaming young people's voice, and also including their perspectives in decision making. We need to make sure our interventions are genuinely responsive to young people's needs and is based on lived experiences of youth and not just our understanding of what young people want. For young people to be advocates and change makers, we need to move the narrative of young people from consultants to collaborators, to partners, to leaders, for young people to be able to take this forward as leaders of whether it's controlling and preventing NCD or any of the other issues that are top of mind for them. Thank you.
Summarized and string together all the information that was given by previous speakers and wrapped them together in a very coherent way and made a very effective pitch. Of course, the onus to exercise agency does not just lie with the youth. What we are getting as a feeler is that the youth is very well informed and very energized, very charged up, wants to do something. But we need to give them those platforms, that kind of an inclusive policy making forum, and ensure that their voices are heard so that they transform, not just as collaborators, but as partners and eventually as leaders. So thank you so much. Very, very nice and comprehensive talk by you. Thank you. I would now request all the panelists to please switch on their videos so that we have them all together on the screen. There are a couple of questions. I'll take them one by one. The initial 1 or 2 questions came to Zoya ma'am and she has already answered. Ma'am, would you like to talk about them a bit, because not everyone is following the chat window on YouTube. So the first question was the source of data that ma'am used in her presentation, and it was NFHS 4 data. NFHS 5 data is being awaited. And then the other one was about the status of implementation across different states. Ma'am, would you like to talk a bit about the Ayushman Bharat School Health and Wellness Program?
Oh, okay, so I'll not bore you further. Just to say this Ayushman Bharat School Health and Wellness Program, in this, like I mentioned, the teachers will be trained as health and wellness ambassadors, and the funds are being provided to states based on their proposal. So what I mentioned in the chat box also is that each state has proposed for a certain number of districts where they will implement this program in the government and government aided schools. So that is the number which I mentioned that Gujarat will do in so many states. Bihar, they asked for Gujarat, Bihar, and I think UP they have asked. So all that information I have given. So it's across the country. So every state is actually implementing it. And I think every state is very interested in this program, because that is, and this is, COVID has kind of come at a time in which people have really realized that it's really important to keep the teachers trained so that they are involved in the health and well-being of the school-going children. So this has been, I think, a kind of very easy thing for us to do, to involve teachers, and this partnership between health and education, I think, will go a long way in strengthening the health-seeking behavior of the school-going children. That I think will be something which we have to see in times to come. What is the kind of behavior change we're seeing in these children as well as in the community and parents as a whole. So I think I will not give any more detail. It will be too much.
Yeah, ma'am, there is just one more allied question from Mr. Ram. He is asking what kind of interventions or efforts are in place for out-of-school children.
Okay, so for out of school, like I mentioned, the community-based interventions are there for out of school, whether and even not just community, I would say even the facility-based, which are the adolescent-friendly health clinics, which are accessible for everyone. You don't have to go to school to go to a clinic. Second, and these clinics are based at the level of medical colleges, medical PHC, CHC, subdivision hospitals, district hospitals, and also at the level of health sub-centers, we have what you call a walk-in clinic. And these are walk-in adolescent clinic because the ANMs or the ASHA who is posted as sensitized on adolescent health. So that is a kind of, I think, we're trying to make it a cross-board provision of services so that any adolescent or youth who comes for services actually is given the right information. In case the services is not available there, the right information as to where to access the services is there. So this FSC is one. Second, of course, the peer educator program, which is mainly for out of school children, but a few states, I agree, a few states are doing it in school also. So that freedom is given to the states where they want to implement this program, but majority are doing it for out of school children. And the Adolescent Health and Wellness Day, which is a very important awareness event which happens quarterly, whether they happen in Panchayat Ghar or in Anganwadi Center or in any other institution, which is selected by the district implementing it. There again, awareness of adolescent health issue is carried out. Awareness, most of the states actually do hemoglobin testing, height and weight, BMI calculation. So a lot of awareness thing happens within the community as well. Yes.
Thank you, madam. I think you also answered to one query by Dr. Pallavi Shukla, who also wanted to know about school educators. You already touched on that. Thank you, madam. The next question is for Dr. Kalpana Apte. Ma'am, this question has been like, how do we tackle gestational diabetes among our youth? Now, of course, let's expand it a bit. Not just gestational diabetes, we can talk about any kind of pregnancy, youth pregnancy related complications.
Yeah,
or
yeah.
Yeah.
Yeah, so gestational hypertension, I think Dr. Richa Mishra, isn't it? So yeah, gestational hypertension. See, it's an extremely important part. India has been very successful in early detection as early as possible. It is increasing the detection. Is, you can say, the incidence is being detected earlier in India, even in smaller towns and cities. The awareness of healthcare worker and the you can say the not the mandatory, I can't say, but a very good practice of early, at least 3 antenatal checkups regularly, at least 3. All those protocols have really benefited immensely in early detection of pregnancy, hypertension during pregnancy. And the sooner it is detected, sooner it can be managed. There are medications which can help, and then it also needs to be some screening needs to be done for the other aspects of preeclampsia, whether there is swelling in the feet, whether there is proteinuria, is there proteins in the urine, and so those kind of things, which triad actually is the preeclampsia. So early detection at the grassroots level, these are very simple things which can be detected very early, even in a family physician's clinic itself, you can detect this early. We don't need very sophisticated instruments, a big setup, and very big hospitals. What is needed is knowledge of the doctor and also of the woman and her family. Regular antenatal checkups are extremely important, first trimester, as well as more importantly in the second trimester. If you detect it in time, then there is, of course, I'm not going to get into the medication, and this is not the forum to talk about the what kind of tablets, medicines can be given. But from a public health perspective, early detection and quick management is the key to this, and this can be done across. This is being done in small villages, and also at the subcenter level, even we have been able to reach to screen pregnancies and detect preeclampsia, which includes, of course, the gestational hypertension. So I think that answers the question, but if there is anything, I would be happy to answer also on the email. You can share my email with everybody. We can talk about it, but it's very easy.
Thank you so much, madam. Thank you also for correcting me. I misread it as gestational diabetes.
It happens.
Handling multiple screens is like a bit.
No, it happens.
Yeah. Thank you, ma'am. My other question goes to Kheda sir. Sir, there is this one question from Dr. Rahul Pal, and he's asking, what are the solutions for reducing screen time in adolescents and children? Promoting more physical activity. I do not know, sir. Yeah, over to you.
Actually, reducing the screen time, there are multiple approaches. And actually, we are coming up with a dedicated module, which is called as, teen parenting. Generally, you must have seen literature and the manuals which talk about, childhood development, how to take care of your children. But here, we are coming up with a separate manual which is called as the teen parenting. How to, improve the capacity of the parents to deal with their adolescent, boys and girls. And under this category, this is the one question which is commonly raised: how to reduce the screen time. The approach which is generally being used is to have to get engaged. What happens in a family, particularly with the coming up of these mobile phones, everybody remains busy in their mobile phones. There is no communication between the family members. With the result, children do not have anything to do except do that screening of TV screening. So what happens? I think the engagement of the family member is most critical, and that point needs to be conveyed to the parents. They can start playing with their children. They can start talking to their children. They can go for maybe some physical activity outside. The kind of the practices which used to happen in the past, which have because of these technological innovations have reduced. So there are a number of tips, but this is a very simple tip which I am saying is that communicating and engaging with your children will ultimately reduce the screen time, not by just closing the TV or closing these things, or not, getting the connections, those kind of, some people are using those kind of a harsh methods. We have to avoid using those harsh methods. So this is in short the kind of the approach, but which is very clearly mentioned in that manual. Thank you very much.
Thank you, sir. We look forward to that manual coming up. If it is already in the public domain, we'll share the link with the participants. I think Zoya ma'am also wants to add to that.
Yeah, I would just, not too much. I totally agree with what Dr. Khera is saying. Parenting an adolescent is a big, tough job, and all of us know that. And it's a beautiful thing which Dr. Khera has been working on, is a parenting guide in which to support these young children, how to deal with technology addiction, what to do. But just to mention that there's a concept which is called the Shut Clinic, which is being run at NIMHANS Bangalore. So they have a specialty clinics which deals with young children who are addicted to internet, whether it is gaming, whether it is social media, whether it is any other thing in which there is excessive use of screen and smartphones, laptops, whatever. So that also is an interesting thing in which there are 8 steps, in which one step is like pre-contemplation, contemplation, determination, action, maintenance, and relapse. Because any kind of excessive use of media, internet often leads to relapse, So this is a kind of intervention which NIMHANS has planned, and which we are also supporting, and we have had a lot of meetings, because we have come to know, and this of course has been shared with a lot of us, is that this growing age is really getting addicted to excessive use of media and internet. So what the government can do, so the continuous dialogue between us and NIMHANS, and they've already created a mobile use screening test is also created. They have a small app, I don't know, which is called a digital detox app, which is available on Google Play Store to assess whether the person is addicted. So small things are being created, and I think we will eventually reach there, because this is a very critical issue which a lot of us are facing. Agree. Yeah. From my side.
Thank you, ma'am. Thank you for adding further details to it. Thank you, Khera sir. Thank you, Zoya ma'am, for that. One last question goes to Ms. Pooja. This question comes from Dr. Naila Afroz. What are good impact should have in our society due to population of youth? Probably she's trying to talk about demographic dividend, or how to leverage the population, dynamic youth population that we have in our country.
So thanks. I think that's a very interesting and also complicated question to answer. I think we've all been speaking about the demographic dividend, especially in India, for a very long time right now. For the last many years, actually. I think what we really need to switch is looking at not just what young people can do for us, but what can we do for young people as well. I think that is what, as practitioners, as civil society, as people from different arenas of life need to look at, is to really to be able to change that narrative. And like I was saying earlier, I think it is to be able to give and enable young people with the right resources, skills, capacity for them to build their own leadership and their own aspirations. I think many of the panelists here have spoken today about how, especially during the COVID-19 pandemic, mental health, mental well-being have become very important issues that we need to address. And I think ensuring that there are the right resources, right people that young people can approach, trusted relationships that they can also establish with their own peers, with adults, is something that we need to be able to enable to take forward. So, yeah.
Thanks again. Nice observations there. We need to skill them and motivate them. And of course, skill agility is again an important way, because jobs have transformed due to the COVID-19 pandemic. So thank you so much, Ms. Rao. Before we conclude this session, and I request Sangeeta Madam for a concluding remark and then a vote of thanks from Kavita Ma'am, I have one announcement coming up after the concluding remarks from Sangeeta Ma'am. Ma'am, I'll request you for your 1 or 2 liners in conclusion. Please unmute yourself, ma'am.
Thank you, Archisman. And thank you so much. Thank you all for coming together to talk excellently and wonderfully about such an important and challenging topic. And I really look forward to having such fruitful discussion with you all in the future. Take care and stay safe. Thank you so much.
Thank you, Sangeeta ma'am, for that brief, sweet conclusion. But this has been a very enlightening 1.5 hours. We have stuck to our timelines, overshot by 4 minutes. But we know that our audience is mostly comprised of young faculty, mid-career faculty, residents in public health and community medicine. So whatever discussions we had is actually striking a chord with them. We are getting very good reception in the chat window on YouTube. And this also motivates them to understand on contemporary issues, to talk to the people who are actually working it out in the field. So decision-making positions, program managers. We really thank you so much for sparing your time. Now I have an announcement for our audience. It's that traditionally our education system is based in a way that we are trained to do primary research and write papers, manuscripts for publications. We are shortly going to launch a competition, not a competition that way, but then a mobilization effort where residents and young faculty could come together. They would learn the skills of networking, of collaborating to prepare technical briefs, policy briefs. So these are beyond just publications, writing policy practice papers. So we shall be making that announcement towards the end of this month. And we expect that all of you who would be interested in hypertension and NCD and would like to learn how to write these technical briefs would join in that effort. And we shall look forward to having more and more such informed, enlightened speakers to come and talk to us. Once again, I'd like to thank all of you, but a formal vote of thanks I would request from Kavita Madam.
Good afternoon, everyone. And after listening to the deliberations and discussions that have been happening since the past 1.5 hours, this has been very insightful and enriching. As I played the dual role, I'm a mother of 2 teenagers and also a public health researcher. So this entire discussion has been, apart from being very insightful, a very eye-opening discussion. So first of all, I take this opportunity to thank all the panelists, the young representatives, Dr. Sai and Dr. Kalika, all the panelists, Dr. Zoya Ali Rizvi from MHFW. Thank you, ma'am, for sharing your learnings about the RKSK experience, and your passion for the program was very, very, very visible. Dr. Kalpana Apte for sharing the effects of hypertension on sexual and reproductive health. Thank you, ma'am, for that session. Dr. Ajay Khera for talking about the behavior change communication and the impact of the COVID-19 on the youth. The questions they have been asking or about all IACT program. So thank you so much for sharing these details. Ms. Pooja Rao for talking about what young people's role in leadership should be and how we need to engage with them. And it is very evident that you all have shared your experiences, thoughts, and perspectives from your work experience. And this has been very, very helpful to all of us. I thank the audience for being present through the webinar and for asking very relevant and contextual questions. Special thanks from our end goes to Dr. Sanjay Pandey from Global Health Advocacy Incubator for facilitating the webinar. Special thanks to Dr. Shaili Vyas for supporting us in disseminating the information regarding this webinar. And last but not the least, I would like to thank our team at GRID Council, GRID BHU, for all the back-end support. Special thanks to Dr. Sangeeta ma'am for her guidance, Dr. Archusman for always, both of you for always, providing us the guidance and supporting the team in every which way for, conducting this webinar. Thank you so much, and thank you all for being present physically, mentally, energetically, and interacting with the audience so well. Thank you so much.
Thank you, Kavita madam. Thank you and your team for doing all the technical back-end work. Thank you so much. Thank you all our esteemed speakers.
Thank you.
Thank you so much.
Thank you,
Thank you.
Dr.
Thank you.
Zoya. Thank you,
Thank
Dr.
you.
Kalpana. Thank you, Dr. Keda.